Hi, and welcome back to the Hippie Martha Hormone Hour, where we talk about cycles, hormones, and what it means to truly support women's health across the lifespan. I'm Ashley, your host, and today's episode is one I've been wanting to do for a long time. We're talking about migraines, but not just take a pill and push through migraines. We're diving into what migraines actually are, why they disproportionately affect women, the hormone and nervous system connection, possible link to those who have endo, the migraine bucket concept, the liver, gut, histamine, and inflammation piece, and what real support can look like beyond beta blockers and triptans. If you're new here, this has been something I have personally struggled with since I was 10 years old. For years, I thought they were just random, genetic, or that I had really bad luck, because that's what I was told by doctors and neurologists. But as I started to understand my hormones and what affected them, my migraines drastically decreased. That's when I realized migraines are often a whole body signal. And today I'm bringing back Morganne Skinner, a fellow RN, herbalist, and FEMM fertility awareness educator, to help us unpack all of it through a hormone and nervous system lens. If you haven't watched our previous episode regarding endometriosis, go back and give that a listen because Morganne is a wealth of knowledge in the endo world as well. Welcome back, Morganne. I am so excited to have this conversation. I saw you post something on Instagram about migraines, and I think I reached out and I was like, we need to dive into this topic. So thank you so much for being on here.
Yeah, I'm excited to be back. I feel like this is a topic that you and I can just talk about for hours for sure.
Absolutely. Would you like to reintroduce yourself and maybe start with, we always, obviously on here, we always start with a cycle day check-in. Would you like to share that?
Sure. Yeah. So, like Ashley mentioned, I'm Morgan. I'm a registered nurse and an herbalist and a fertility awareness educator. So, I teach the FEMM method, which is fertility education and medical management. And I work with people pretty much all over the world online. I am on cycle day 20, which for me is it's 5 days post my peak day. So I am in my luteal phase, but I'm still in like the beginning part. I'm feeling pretty good, pretty stable. This is the part of my cycle where things that would normally really stress me out, I'm just very, very chill
Yeah,
about. So it's quite nice.
that's awesome. I know I typically try to record during like follicular phase, or I try to like ask people when they're going to be in that, and it's so hard to like sync up. So I'm glad that you're still in that a little energy phase.
Yes.
I know I am on, let's see, I'm on cycle day 8, and I am heading into that kind of that time where I typically get my migraines. So I've been doing everything to kind of support my body, and that's kind of where we're going to start and dive into is, first off, I guess, do we want to just describe what a migraine is? I'm sure if you're listening to this, you probably have experienced a migraine, and that's why you're seeking out help. So, but for anyone who just wants a little context about the difference between a migraine and a headache, do you want to explain that a little bit?
Yeah, so kind of like a very like simple way to distinguish is headache tends to be more localized pain, but the rest of you kind of still feels the same. You can kind of go along through day, you don't really feel sick, but you have that headache and it can be different in sensation and different triggers for different people, but usually it's fairly mild for most people and more local. Whereas a migraine, it's a lot more involved, it's more systemic, kind of can have a whole body response where there's not just the pain in the head, but it can also cause stomach aches, dizziness, nausea, lack of appetite, temperature dysregulation, sensitivity to light, noise, things like that. And with migraines, some people get what's called an aura, which can be different for different people, but it's basically like a signal to them that the migraine is coming on. And I guess the other distinction that kind of separates the two is the longevity or the duration. So migraines tend to last longer. For most people, it tends to be a couple days. For myself, it has like a waxing and waning period. So it might not be as intense the whole time, but it comes on, then it goes off. Whereas a headache can be for a couple hours or maybe all day for somebody. Yeah, so that's kind of like the
Yeah.
difference between the two.
Yeah, absolutely. I would totally agree with that. And I think it's funny because those who have migraines, they're like, oh, this is a migraine. Like, usually you have a side that the migraine comes on. And yeah, mine tend to last, 2 days. And then after that, I know, okay, it's going to go away. So I think sometimes having that in your head, especially if you suffer chronically from migraines, that can at least get you through that stage of, not feeling well, you know that it's going to end at some point.
Yeah, that's true.
Let's kind of dive into cyclical migraines and maybe talk about estrogen fluctuations, why people tend to get more migraines during specific times of their cycle.
Okay, yeah, there's a lot I can say here for sure. So if I forget something, bring me back. But with estrogen, so there's kind of like I'll call it two buckets of where people fall when it comes to estrogen triggered migraines. It's usually when estrogen is rising or when estrogen is falling. So when estrogen is falling, that can be called like estrogen withdrawal, migraine. That tends to happen for people at the end of their luteal phase in the first 2 days of the period. That's when it's like that withdrawal of the hormones. There's other triggers when the estrogen is rising, and that can trigger headaches as well. So for people that experience that type of migraine, that is typically when the period is over in the early follicular phase, where follicular activity begins and estrogen starts to rise, and also around ovulation. So around ovulation in the cycle is when estrogen is at its highest. And interesting about those 2 points, so the early follicular and the ovulation, is we're not making progesterone yet. So at this point in the cycle, estrogen is unbalanced. And I mention that because we have a second rise of estrogen after ovulation, but we have progesterone. So that time of the cycle usually isn't a trigger for most people because the progesterone kind of balances out the estrogen. So those are kind of like the two main camps. For myself personally, I experience migraines when estrogen levels are changing. So I can sometimes get it when it drops and when it rises. And there's a few different reasons behind that. Did you want me to talk about that now?
Yeah.
Yeah. I say there's just so much that we can get into because it's so interconnected with different body systems and everything. But I guess to start, when most people hear estrogen, they think of it as a sex hormone, but estrogen affects pretty much every part of the body. We have receptors all over the body, and it affects the brain. So you might not think immediately estrogen and headaches, like what, how is that even related? But it affects the brain. It also affects our blood vessels. So we have estrogen receptors on the blood vessels as well. And when estrogen rises, there's a few different ways it acts on the blood vessels, but it basically can make it a little bit more hyperreactive and make it more prone to vasodilation, which those who have headaches probably already know, but a big trigger for headaches and migraines is vasodilation. And so when estrogen rises, the effect in the blood vessels tends to be this vasodilation, which then can lead to migraines. Estrogen also increases something called nitric oxide. And that's partly how the blood vessels vasodilate. Fun fact for the other nurses out there. I think this is really interesting, but so nitroglycerin is a very common medication we give when somebody's having chest pain to help open up the blood vessels to bring blood oxygen to the heart tissue. And in the body, nitroglycerin breaks down and turns into nitric oxide. Well, we make that already. The other thing that's really interesting is that in studies, when they want to induce headaches, they actually give participants nitroglycerin. So if you think about it, it's like, oh yeah, of course, when estrogen is rising and nitric oxide is increased, that can be a very clear trigger to headaches. That's when estrogen is rising. When estrogen is falling, there's a few different ways that can cause headaches, but essentially, if we're looking at it from the blood vessel lens, it can almost lead to like this instability with blood vessels. And so it can almost spasm or not react properly. And that can cause headaches in some people with that as well.
As I mentioned earlier, that migraines can actually affect women more so than men. And would you consider that because of all of the hormonal changes or the fluctuations in estrogen more so because we are obviously more hormonal?
Yeah, I think so. Like just statistically, women are 2 to 3 times more likely to have migraines than men. And it's more prevalent in the peak reproductive years, which is quite interesting. And before puberty, there's like really no differences in sex. So I think that's quite interesting as well and really suggests that there is a hormonal component to it. And I think like when it comes to migraines, there can be like a primary trigger, primary driver, but I don't think it's truly ever just one thing. I think there's like multiple things that go into it, or maybe something is more important for one person or like more likely to be the final trigger, but I think there's multiple buckets. So I think the hormone is one piece, but I think there's also other factors. We can't ignore the hormone piece. It's kind of like one of the leading drivers in the differences between the sex. I would also guess the nervous system probably plays a big role in stress as well,
Mhm.
contributing to like the differences in the prevalence
Yeah.
in versus men.
Yeah, I definitely have also seen that those who have like childhood trauma, sleep deprivation, stress, blood sugar
Mm,
issues, like it's like this. If we think of the migraine bucket, okay, you have this bucket and you have all these like triggers that stem and you're putting into this bucket. At some point, that bucket's going to fill, just overflow. And
right.
you really need to try to reduce the things that you put in your bucket so that you can reduce those episodes.
Right. And then you also, when you're thinking about not only are women, we have times throughout the cycle where estrogen is really high, which can trigger migraines, but there's a lot of instability and variability in the cycle. I don't think it's just the fact that we have high level or we can make high levels of estrogen. I think it's the changing, or I'd say more so when somebody is already has like a hypersensitive or hyperreactive body system, or what I want to say like in those bodies who are more hypersensitive, like with endometriosis, where there can be like visceral hypersensitivity and autonomic dysfunction, more likely to have migraines because of that as well. So like you're saying, different buckets, but also there's a lot more instances where the hormones are changing quite drastically.
Yeah, and like we said, like that is definitely a trigger. So what can we do? When I look at it, and even for myself personally, I'm like, okay, what can I do to keep that bucket less and to create more stability in our cycles? So do you want to kind of go that route?
Yeah, so I think so something like no matter what the main driver is, I think nervous system regulation is really important. And like if you just think like when you're stressed, how resilient are you and how adaptable are you? You know, like everything just feels that much harder. But it kind of applies internally too. So when we have a lot, like when we're feeling overwhelmed and our nervous system is overreactive, the reactions don't go as smoothly. And the autonomic nervous system affects our blood vessels as well and our pain censoring. And so that can, if we can modulate our nervous system and kind of soothe it and calm it, well, that's like one less thing that's going to fill the bucket, right? That's like one factor. So things that modulate the nervous system, and this can be very different person to person, but body work, like yoga or massage. Acupuncture is my favorite for it's kind of like a neuromodulation without like having to take a drug or
Yes.
anything like that. It works on the nervous system in lots of ways. So there's lots of different ways you can support your nervous system. Those are just some examples. Other things for migraine management and prevention, I'd actually say that like you really want to focus your energy on prevention. It's a lot easier to prevent it than it is once you are in it, which for those listening with migraines, I'm sure they already know and have experienced that. I guess I can share kind of what I do for myself and how that works. So for me, like I mentioned before, my main driver is levels of estrogen. And we didn't mention histamines, but that can be a main trigger for certain people. Typically, that shows up around when estrogen levels are at its highest, not always, but that's more often the pattern. And there might also be other signs and symptoms of histamine intolerance or excess histamine. I don't suffer with those. So my mind immediately wasn't like, oh, this is a histamine issue. I did evaluate it, but it wasn't where my mind went to first. For me, what seemed to be most likely was that my estrogen levels weren't really out of balance, but my body was overreactive to the level of changing estrogen. So it was more of like a hypersensitivity, which I also have Raynaud's disease. And so for those who are unfamiliar with that, it's basically like a circulation problem. So it kind of makes sense that for me, my vasculature and circulation are just a little bit more sensitive. So when estrogen changes, blood vessels are kind of like, what are we doing? How do we react to this?
Right.
And so it makes it a little bit more hypersensitive. Things that I've found that have worked. Number one is acupuncture. So I've already go to acupuncture to manage endometriosis. I didn't already say that. I have endometriosis and I did have excision surgery for it a couple years ago, but I still do things to manage it. And one of those things is I go to acupuncture frequently. After my period and leading up to ovulation, I will specifically time when I go to acupuncture. So I will go to acupuncture the day after my period ends because through charting my cycle, I've found that the migraine typically comes uh, around 2 or 3 days after my period ends. This is before I start to get any change of cervical mucus. So I'm still having dry mucus, which shows me that I'm not having rising estrogen yet. So that's the time where my period has ended. The estrogen hasn't started to quite rise yet, but there's still this shifting and changing that's going on. So that's when I'll go. And then I will also go again at my point of change, which in FEMM, point of change is that first day of fertile type mucus. And then I usually go again on my peak day, which is the estimated time of ovulation according to FEMM. So doing that in combination with taking magnesium and B12 is something that I added in recently. So magnesium, I chose that because it kind of tackles a lot of the things that can be a migraine trigger. It helps to stabilize mast cells, and mast cells are what release histamine. It helps to support and kind of modulate the nervous system. And it also helps the blood vessels to do their job as well, because blood vessels have to open and close, dilate, constrict in order for blood to go where it needs to. Magnesium helps with that. Magnesium also, in like an indirect way, helps with our hormones as well. So magnesium just does a lot of different things.
Does. What type of magnesium are you referring to?
That's a good question. So I am taking magnesium glycinate, and there's lots of different forms of magnesium to take. Glycinate is good for the nervous system and for your mood, for mental health as well. But it's one of the ones that is kind of like the most gentle on the GI tract. So I actually chose it for that reason, not and it kind of worked in my favor that it also works really great for like nervous system, for the brain, for mental health and everything. But I take it, normally I take it every day at night, but from day one of my period through my point of change. So for me, that ends up being around 10 days of my cycle. I will take it, I split my dose in half and I take it in the morning and I take it in the evening. And once I shifted that, it made a huge difference on, I completely prevented my migraine, which was wild because with acupuncture alone, it sometimes prevents it, sometimes it doesn't. Like full transparency, it doesn't always help. Usually it reduces the severity and duration, which that is amazing as well. Once I started adding in the magnesium with the acupuncture, that's when I was able to finally prevent it. And by splitting my magnesium dose, that has helped a lot. Then the other thing I do is B12. So I mentioned for me, the blood vessel, I'll say like dysregulation is a big trigger for me. B12 is really an interesting one here where it helps stabilize blood vessels, but it also helps and kind of protects the nerves. And so another like thing that happens when estrogen levels are changing, estrogen also affects our neurotransmitters and B12 protects them essentially. And so that was why I added in B12. I'm not deficient in B12, but it was something that I thought like, okay, let me just try and see if this is going to help with the extra support. And it really has, like, it helps me feel so much better. And kind of doing all three of those things together has helped me to prevent them.
That's amazing. Do you find that, do you take the B12 like in the morning then? Because
Oh,
B vitamins
yes.
can definitely be very
Right.
stimulating.
They're very, it's like an energy drink and a
Yeah.
pill. Yes, I take them in the morning or like I'll make sure if I forget, I take it by like lunchtime. And with the B12, so like I take a multivitamin and it has B12 in it, but I take like a separate B12 on its own during my period, the same time when I'm splitting that magnesium. So the first 10 days of my cycle, that's when I'm adding in the extra B. And I did actually, I was quite disappointed. I looked for studies to see if B12 levels change throughout the cycle and couldn't really find many studies on it. But nutrients in general, like we lose a lot when we bleed. And so I would suspect that we are in like a functional deficiency during the period. So possibly that's why adding in the supplement helps. But either way, I have found that it helps.
Yeah. Well, and we talk about how estrogen is like helps with neurotransmitters. And I also want to address that the gut is a huge thing. So if your gut is dysregulated at all, like if you have dysbiosis, that can really affect, those neurotransmitters as
Absolutely.
well as how you process estrogen. So adding in, I guess, how your body can recycle or get rid of estrogen. So a
Mm.
lot of times people who are noticing migraines that are more cyclical, they have like you said, that estrogen dysregulation. And a lot of times it's because of like possibly gut issues or things like that. So,
Yeah,
if
for
you
sure.
are struggling, like that can be one thing to help. And magnesium glycinate is really good at helping you poop. And
Yes.
so, and I don't know in your practice, but in my practice, that's like one of the first questions. Do you poop daily? Because if you're
Right.
not getting rid of those extra toxins in your body, that's adding to that bucket. So, but magnesium
It's so
glycinate can
funny
be
because I
really good for
think
that.
like it's so fun. I'm glad you said that. So we cover different perspectives for whoever's listening because it seems like most of the people I work with have the opposite problem where diarrhea is a big concern.
Oh
And
gosh, yeah.
so my mind is like, oh, glycinate is very gentle, but it also like it's also dose specific, right? So
Yeah,
like I think that's something that's great with magnesium. Like if it's too much or not enough, like you can kind of titrate the dose a little bit to find what works for you. Like if you're having diarrhea, probably cut down the dose a little bit
exactly.
or do what I do and split it, have it some in the morning, some at
Yeah.
night. So it's not as much of a hit on the system all at once.
And I think that it can also be good, especially like if you have a hard time like relaxing or just kind of like chilling out through the day, or that you're just like constantly on the go. I think magnesium can be really helpful to use in the morning because then it kind of keeps you level.
Yeah,
It protects those nerves. Magnesium threonate is another good one that like supports brain health. So if glycinate is, maybe not working for you, threonate can be another option as well. There's so many magnesiums out there. So
right.
I get a lot of people who are like, well, what kind do you take? Like what brand or what just there's like what 6 different kinds of magnesiums. Kind of just
Yeah, there's so many.
seeing what works. Most of them work similarly, right? I mean, we're so magnesium deficient as a society anyway in the United States. I know you're not in the United States, but we need magnesium most of the time anyway. So,
Yeah,
yeah, such good stuff. I love your way of treatment because I feel like it's very simple. And I want to also note that you're just doing this at specific times of your cycle,
right,
correct? Yeah.
right.
So we're essentially cycle syncing for migraine support. And I think that can be really important to know and know where you're at in your cycle by charting your cycles using a fertility awareness-based method.
Right. And I will add to that that if I wasn't charting my cycle with FEMM, because before I learned FEMM, I was charting with Clue, like in the app. And even though it allows you to put symptoms in there, it still is mostly kind of like calendar based, where it's projecting things and like guessing things for you. It'll tell you when your period's coming, it will tell you when you're ovulating. You're not really the one making the decision. And if I was using just that, there have been times where, so I'm 31, I'm not in perimenopause, but I still have experienced many cycles where I've ovulated very early. And so if I'm just looking at the calendar date, there are times when I'm already in a rising estrogen phase and a period tracking app would tell me my estrogen's actually low, but in my body it would be rising. And so my point is that when you're not charting your real-time signs, you might be missing the changes of the hormones and you might not be able to really identify your actual triggers
Right.
because like I mentioned before, there's different like when you're treating a migraine, you want to be looking at what your main triggers are. So if you don't know that, you might not be able to find something that's helping you as much if you think, oh, well, this is the time where my estrogen's low, but really it's the time when your estrogen's high. Those are very different things.
Yeah, like I have seen it on my own cycles, I've seen it on other people's charts where I'm like, every cycle day 7, you're starting to get triggered. Like,
Mm,
this is your trigger day. And so let's prevent that, right? Like, let's
yeah.
start before cycle day 7 so that we can do it. And most of the time, if we get through one full cycle without a migraine, they're like, holy crap, that was amazing. And then you you kind of can't see that compounding effect. People are like, well, why don't neurologists know this? Why don't, because they don't study the cycle.
Which
That's kind
blows
of,
my mind that
it's,
that we're not all using it to
I
guide
mean,
treatment and
I
everything.
started my period at 10 and that's when my migraines started. And it was, looking back, I'm like, all the stuff that I went through, I mean, sleep studies and MRIs and brain wave things sticking on my head. And it's like, it was because I had my period. It was cyclical. And a lot of
Yeah.
this could have been prevented with just simple things like magnesium, acupuncture, even just like addressing, for me personally, I have more of a histamine issue. And
Mm,
so it's just crazy to me how doctors are kind of lagging, I feel like, um,
yes.
in this treatment.
Yeah, because there's so many different triggers, and especially when it's something so tied to the menstrual cycle, you would think like, can we look there? Can we look at that? And then my mind also goes to like, wow, like you had this starting when you were 10 years old. Imagine if they had looked at your menstrual cycle and seen the connection between like migraines and endometriosis and all the other
Yes.
things. Like to me, I'm just like, it's all so
Yeah.
interconnected, and
Yeah.
that's just another story though.
I know, right? Well, actually, do you want to get into how it's connected, how endo is connected with migraines?
Yeah, we can for sure. So there's a few different, how many times am I going to say there's so many different reasons?
I know.
But there really are so many different reasons.
It's a very nuanced topic because what one
Right,
person experiences, the other person might not. And so, like, if you're listening, like, we're obviously, Morgan and I have a lot more experience, and we could probably help you through what you're dealing with personally. But this is really just an overall thing, if,
right,
just to
right.
put that out there.
So I'd say like in general, so like I think we said this, but just to make it very clear, you're more likely to have chronic migraines if you have endometriosis. So that's a comorbidity of endometriosis. And there's a few different reasons why that is. I'll try to cover them. So we already talked about the autonomic nervous system. So people with endometriosis tend to have dysfunction with the autonomic nervous system. And that autonomic nervous system, it's the nervous system that controls the things you don't think about. So your digestion, your blood vessels, things like that. And so with endometriosis, that can be dysregulated. And so because of that, that can lead to migraines when we think about the blood vessels not dilating and constricting like they need to, like I mentioned before. Also, inflammation. So, inflammation causes a lot of problems in the body,
Hmm.
and endometriosis causes chronic inflammation, and it's systemic. And that can also be a migraine trigger. And if we use the analogy of the bucket, let's just say like all these things are filling up the bucket, right? So we already have autonomic dysfunction or potential. At the very least, we'll say there's some sort of sensitivity. Then we have the inflammation. There can be excess estrogen in some people. That usually, at least local estrogen is an excess. Not everybody with endometriosis is going to have excess estrogen on their, like when you get your blood drawn, but there can be, what I see more often is a progesterone, like low progesterone. So in the body, there's this unbalanced estrogen. Even if it's not technically high, it's unbalanced. And when it comes to all the different what things that can lead to a headache or a migraine, I should say, we want estrogen to be kept in check, which progesterone does. So hormone balance, that's like another thing in the bucket that can lead to or can contribute to migraines. Along with the inflammation, we have prostaglandins being high in those with endometriosis. And that's a inflammatory substance itself. And
And
then
prostaglandins are
estrogens,
typically higher right before your period and on your period. That can
exactly.
also be
And around
another.
ovulation,
And around
fluctuations.
ovulation, yes. Yeah,
Yes.
it just naturally
Yeah,
is.
no,
So,
I'm glad you said that. It's like all of these things together. So we have the rise of the prostaglandins, the changing of the estrogen, the all those other things. So the other thing with endometriosis is those with endometriosis tend to have higher levels of mast cells. So mast cells are a type of immune cell, and basically they are detecting threats in the body. And when they find a threat, it releases chemicals that can be a little bit inflammatory. One of the things mast cells release are histamines. This is not inherently a bad thing. Like it's part of the body's immune system. But when it's in excess, this is when it tends to be a problem. Those with endometriosis have higher mast cells. And so more mast cells, more histamines. Histamines are a common trigger. So when you put all those together, we basically have like all of the things that can lead to migraines. Somebody with endometriosis has like
Mhm.
more risk factors basically when you consider all of those things. I might be leaving a few out, but those are some of like the big ones.
Yeah.
So it kind of like, yeah, just makes sense that unfortunately those with endometriosis more likely to have migraines.
Yeah. And I think it's so important to note too that our cycles, like when Morgan and I are talking about tracking your cycle with a fertility awareness method, if you're working with a educator, we can see those imbalances on your charts too to help you
Right.
kind of understand, whether maybe you're estrogen dominant or maybe your progesterone is just low and you have that imbalance of estrogen to progesterone ratio. So understanding that it's so important. My doctor ended up putting me on birth control just to get rid of my hormones so that I wouldn't have migraines. And
And
it
that's like a migraine
actually
trigger itself.
it wrecked me. It wrecked
Oh,
me. I mean, I was having
uh,
probably 2 to 4 migraines a month on birth
oh my
control.
gosh.
It was horrendous. And, looking back, it's like I could have solved a lot of issues had I just known what was going on in my cycle and been
Right.
taught this. So it's really important to know the basics and to know where you're at in your cycle and to learn that because we aren't just taught it in school. This is something that you probably have to go out and look for and be taught by an educator so that, you can always just go read a book, but it's a lot easier being taught by an educator
For sure.
because we can see a lot of these things and we can see histamines, we can see gut issues. A lot of times we notice that during, through you charting your cervical fluid, even whether your estrogen is high or low, or what we're seeing as patterns happen in that cycle. Definitely, there's like so many, it's so broad of a topic. And I know Morgan, when we started, we were like, this is such a broad topic. What do we want to cover on? And I think
Right.
so far, I think we've done a good job. So, definitely cyclical estrogen, sensitivity. We've talked a little bit about the gut. So the gut and the liver, I don't think we've covered too much on right this
Mm,
second, but the gut and the liver also play a big role because that is, we need estrogen clearance. Liver
right.
is kind of, how would you describe the liver with estrogen? I feel like it just kind of helps with like
Yeah, I think like the
modulating
way
it.
we're like putting it simple, I
Yeah.
think like liver helps break it apart and the gut helps push it out. So both are helping like detox. They just do it in different ways and both are important, but the gut, and I think you had mentioned this before, like if there's dysbiosis, it can cause problems because there's certain gut bacteria that can kind of recycle estrogen and put it back in the bloodstream. And that's a burden on the liver because the liver has to detoxify it once again. And so it can be this like cyclical thing. And it can be two things at once or both and, right? But
Yeah.
they both play important roles in maintaining the estrogen balance, but also with neurotransmitters as well. When we think about the gut as well.
Yeah. For those who have what I've noticed too, even and this is speaking personally because a lot of this is personal for me. I have worked with people too, but I think the nervous system regulation has been a
Mm.
big help. It's helped me immensely with gut issues, even just migraines in itself. I don't know how I want to put this. It I've just noticed a huge difference. I think coming from, especially if you have grown up with trauma, childhood trauma, or any type of trauma in your life, and then don't address that, it kind of just keeps adding again to that bucket. And so when you start focusing on that path to nervous system regulation, that can really solve a lot of problems in a lot of people's lives. And so, especially mine, it has been huge. And I think that's probably the major player in my migraine besides solving my histamines. And dealing with histamine issues that I've noticed. But also, I think if you were to just focus on one thing or could only focus on one thing, I think that somatic healing journey is a big one.
Absolutely, because the nervous system, like its whole job is to keep you safe. And so if there's any part of you that feels like you're not safe, whether that's like from trauma, like you talked about, or whether it's like a cyclical thought or a fear, whatever it is, that's still like our nervous system is very much connected to the emotional center in the brain too. Like they're interconnected. And so it's still creating this like chemical response internally that can be activating the nervous system, the more stress response. So when we can like soften ourselves, like even if we just think about it mentally, like when we're like calm and we feel safe, we're not tight and guarded and rigid. And
Mhm.
I think most of us have the experience of like a day that we're stressed, we get a headache. Well, that tension, it's not just in your stomach or in your core, but it also affects blood vessels in the brain. Like it literally can
Yeah,
set the stage for the migraine. So absolutely, like totally connected for sure. And like when you work on the nervous system, you get other benefits elsewhere as well. I'm just
absolutely.
thinking about like, yeah, if there's one thing you can do supporting the nervous system, it's gonna positively impact so many other body systems.
Yeah. And if you're like, well, how do I do that? So, one thing that has helped me personally is it's somatic therapy. So, it's like movement therapy, but even just a simple like legs up the wall,
Mm.
tapping, belly or diaphragmatic breathing, vagal nerve stimulation, pranayama breathing is
Mm-mm-mm.
also really helpful at kind of giving you a natural pain reliever, especially if you are like in like the episode of having a migraine, that can also be really helpful for pain relief as well.
Your breath is also something that you can control. So I love to tie that back to like the trauma piece because especially, and this goes back to like having chronic pain, endometriosis, and really any chronic health condition, but I'd say more so chronic pain when you're kind of like stuck and you don't have a lot of agency. You always have control. Well, I shouldn't say always, but you have control over your breath and
Mhm.
that's something you can practice pretty much any time and it gives you that agency back. So I like that because it's a very like trauma informed approach to regulating the body because like for certain things like yoga or meditation, it kind of assumes that sitting still is safe, but for some people that's actually not like
Yeah.
they feeling safe being still can be quite scary. And so yeah, the breath work, it's something that you have full control over. And one thing I really like to do is pairing it with a grounding. And it's called a 3 and 3 technique. So most people might have heard of box breathing, where it's like breathe in for 4, hold it for 4, breathe out for 4, hold it for 4. It's paired with that, but you're looking around your environment and you look and you name one thing, and then you do the box breathing 3 times, and then you repeat that 3 times. And so it's kind of getting you into like the here and now. And for me, I am somebody that meditation, I can't stand it. I can't sit still for that. It does not feel good to me, but this box breathing type thing, it's actually something that I can turn to and I find it really effective.
Yeah.
And breathing exercises is kind of, it sounds so simple, but we are literally telling our body you're safe and you can relax. Because you
Yeah.
think about like, oh my gosh, it's an emergency, I'm breathing fast, I'm moving fast. Like your body feels like, oh, we're breathing fast, there's a problem. Or we're not breathing deep, there's a problem. But if we breathe slow and deep, it's like, okay, we're
It's
fine.
safe.
Everything's still
Yep.
like we're good.
Yeah. And I also think that you can, if you feel it's like a migraine's coming on, I feel like telling yourself like your body is in a safe state can
Mm.
also help to kind of prevent that too. Like it's not like all of a sudden like clenching, freaking out. I teach this a lot to my histamine clients. If you feel that things are rising or you feel you're getting hives, tell your body it's safe. Like that's the first part, is like that mental part, because it really can kind of slow things down and bring you back into the present so that you're not just like in this fight or flight mode. Because if you're in that fight or flight, your neurochemicals are changing instantly, like they're
Exactly.
going from 0 to 100. So if you can
Yeah. No,
kind of bring that back, that can be really helpful. I know you gave your suggestions. Do we want to give any other? I have on here some herbs that can help in the
talk about
moment.
some herbs that can be helpful.
Yeah,
Yeah.
I
So
go ahead. You start because you're the herbalist. I do herbs. I have like my set of herbs that I like, but I want to hear from you.
yeah, I mean, disclaimer, everybody's different, right? And so when we're looking at herbs, we also need to consider the person's constitution, whether they run hot, whether they run cold, looking at the whole body. But I'll give some pointers or tips to point people in the right direction for things that they can kind of think about. So if we're thinking about if histamine is like a main driver, then we want to look for herbs that are natural antihistamines, have things like quercetin in them. And so my main choice when it's in the lens of women's health would be nettle, because nettle is also very mineral rich, but it's a natural antihistamine. So that's a really great choice. There's a few others like feverfew and butterbur are some. There's a lot of other herbs actually that are less known for their antihistamine properties that have antihistamines in them, like ginger. Most people don't know this, but it has like a small amount of it helps to stabilize mast cells, but it's more mild and moderate. But the more well-known ones is the nettle, I would say. And then for nervous system support, if we're thinking about that, two of my favorites are skullcap and valerian. Valerian is warming, so that's my top choice because most of the people I work with, especially with endometriosis, they tend to run cold. And so I don't want to make them overly cold. But that's not always the case. Skullcap is cooling. And so if you're somebody that runs warm, then balancing it out, skullcap could be a good choice. But both of those are nervines. If you're having a lot of like digestive tension or digestive irritability with the migraine, then chamomile is my first choice for it relieves tension kind of in the whole body, but it has an affinity for the digestive system. So it's really great for relieving tension there. If it is pain driven or inflammation driven, then my top two choices would be ginger or meadowsweet. Meadowsweet more so for inflammation, ginger more so like in the moment. I mean, both meadowsweet actually is where aspirin comes from. So meadowsweet is actually a really good choice for relieving pain, but it's also very anti-inflammatory as well. So those are kind of the herbal recommendations. And for most people, you're going to be doing a mix. So for me, I do nettle in the morning, then I do, because nettle can be diuretic as well. So I don't want to drink that right before bed. So I usually drink that in the morning. Then I usually drink ginger throughout the day and then chamomile at night. So those are kind of like my three go-tos. Yeah. And if I need extra nervous system support, then I might go to a tincture of valerian. But it all kind of just depends on what it is or it depends on like what it is each person needs. But like those are like some pointers.
Yeah, absolutely. And I think also the key thing too is that you're getting these minerals and nutrients from plants versus, having to take a million different supplements and things like that. Like, and you're
that are
hydrating.
Depleting you.
Yeah, that are depleting you. Yes. And that I think being mineral deficient can also be one of those migraine bucket things. Like if your minerals are off or you're just mineral deficient, it can cause a lot of triggers and issues, not only with your cycles, but also with your hormones. And then that causes migraine issues. So it's kind of like this, once again, that circle, like it's all dependent on kind of your constitution, what is going on in your body. But minerals, I think, are very overlooked in people. And so that's like, if I start to feel one coming on, like I will make sure I'm, getting my mineral drops in or drinking a nice herbal tea to get everything in with like a good sea salt and all of those.
Oh, yes. And hydration. I think like this is like the most simple thing you can do.
Yes.
But like, I'm not saying that, oh, you just need to drink a cup of water and that's going to fix all your problems. No, but you need to make sure you're not forgetting about that, especially after the period when you're losing a lot of fluids. But I think staying hydrated is extra important for those with autonomic nervous system dysfunction, where the blood vessels are not responding properly. If we can add more fluid, that kind of helps buffer some of the extreme reactions. And so that can be really helpful as well.
Yeah, absolutely. Do you mind if I just share my little remedies that I've
No,
done?
I want to hear.
Okay.
Yeah, let's hear it.
So for me, what I've noticed in the past year or so is, well, we'll start off. So I've had hormone at PCOS, undiagnosed endometriosis, like all of the things. I'm just not brave enough to get the surgery. But honestly, I've noticed a huge increase in how I've done things. But so in my experience, using histamines has been a huge decrease in migraines. And I will say, like, I've had migraines, like I said, for years and years and years. And I've done the triptans, I've done the beta blockers, I've done you name it, I have tried it. And just by kind of adjusting where I'm noticing higher histamines in my body and being body literate has helped a ton. So, what I usually do and what I notice in my cycle, especially because now I am perimenopause, I'm 41, going to be 42 this year. And so I am noticing changes in my not only my cycle, but in my estrogen and progesterone patterns. And so I love to start with herbs like ginger and chamomile. Those are like, especially for that prodromal phase of, okay, I feel like something's coming on. I feel like my bucket's getting pretty full. So I start kind of treating early. And I usually treat like 2 or 3 days with ginger before my period. And then I'll do chamomile at night, just kind of to soothe things out and help with that GI issue and things like that. And then what I've been doing is from cycle day one until I ovulate, I take enzymes like dehist or like you mentioned, nettle, quercetin, bromelain. It has all of those things in there to kind of help break up extra histamines that my body is producing. And
Mm.
then I also, if I'm eating leftovers or if I notice like I'm feeling really flush, I'll take a DAO, which is an enzyme that kind of breaks down that histamine in the body as well. And I also talk about eating less leftovers. Leftovers have a ton of high histamines. And it's funny too because we eat a lot of like canned fish or canned meat, oysters. Like people talk about how high in protein they are. You know, you're trying to get your protein in, but they also don't talk about how high of histamines they have in them.
Right.
So I try to reduce those, especially just in my follicular phase. So after ovulation, I can tolerate them a lot more. But if I'm going to eat them or I'm like, oh, this is all I have right now, then I just take a DAO. And then once again, balancing minerals has been huge, especially for my PCOS. I tend
Mm.
to run high copper, and so I balance that with zinc and then the magnesium glycinate at night. But I am going to try to take your approach and take one at night and one in the morning to see if that makes a difference. So
Yeah.
I
Yeah.
love,
Try
I love,
that. Let me know. But I love the ginger and the chamomile before the period because both are very anti-inflammatory and both lower prostaglandins. I know I've talked about ginger lowering the prostaglandins before, but chamomile does as well. And ginger in particular is also really great at improving circulation. So ginger is a warming herb, but it kind of sends blood where it needs to go. So we talked about acupuncture before as helping like to modulate the nervous system, and acupuncture moves chi, which is
Mhm.
kind of like your energy, your life force. Ginger kind of works similarly, but internally. And so that's like a really great choice. And when I'm thinking about herbs, I'm wanting like what's going to have the best bang for my buck, right?
Yes.
I love those choices. And yeah, I also when you were talking, I was thinking about like one thing I don't think either of us have mentioned yet, but about like the importance of sleep and
And blood
stress. I
sugar
think we touched on
regulation.
so
Sleep
much
and
to
blood sugar
say,
regulation.
much we haven't talked about,
Yes.
but I think like I imagine this is probably something that you do as part of your management as well. But for me, like I sleep has to be a priority during my the times where I'm migraine prone. Sleep has to be a priority. That's not the time for me to stay up late to finish a work project or watch Netflix or whatever. Like I have to be in bed or I will pay for it the next
Yes.
day. So stability and routine really helps as well. So like eating regularly, drinking enough, all of the basics
All of
that
the
we all need to
basics.
do. Like we talked about having the bucket and analogy, and I think that's where these fall in. Sleep
Mhm.
impacts kind of everything. It's one of the most important things we can do for our health. Yeah, I had to mention that because we hadn't mentioned it before. And I thought, oh, yeah, that is something that is super important, that having a regular, good sleep schedule is something that really helps me as well.
Absolutely. If you're having an in the moment and you need in the moment support, I
Mm.
have kind of like a little list of what has been helpful. So I was just going to share that really quick because I know some people are like, well, what do I do? Like how do I get through this moment because
Mm,
you just don't feel good.
right.
So for some people, a cold cap or ice on the vagus nerve, which is like neck, like your neck area, or like near your jugular, basically, that can be really helpful at just contracting those blood vessels. Dark room, sensory reduction, we all know that. Typically, we're just like, don't talk to me, don't look at me.
Right.
Keep magnesium. We talked about magnesium. We talked about ginger. Ginger has also actually been proven like it's like ibuprofen basically. In higher doses, especially the capsules of ginger can be really beneficial for those who, like, if you're just getting a migraine, taking, 1,000 milligrams. I don't, how much do you recommend typically?
Yeah, for period pain and migraines, it's different. For migraines, usually it's a higher dose, so usually
Okay.
1,000 milligrams at a
Yeah.
time. But if you're sensitive or something, you could split it and see if that works. But you're gonna need more than a cup of tea here
Yeah,
for that effect. But yeah,
absolutely.
1,000 milligrams is
Yeah.
usually
And then nervous system down regulation, which we talked about, kind of just making sure that your body is safe. If you can't get into acupuncture, you can do acupressure points. So I actually just took a Vietnamese base acupressure class and it was
oh
really
interesting.
interesting. I learned a lot and you can use the end of a ballpoint pen, but like there's different parts on your face, on your fingers, on your arms that you can use to stimulate, open that chi, and kind of help with pain and like dysregulation too, which is kind of
I love
cool.
that.
Caffeine timing, this is what doctors are big, like take a Benadryl and take caffeine. And the
Mm,
Benadryl's for the histamines, right? And then they'll usually, like, the cocktail that they give you at the hospital has typically an anti-nausea medication. It'll have Benadryl in it, and then it'll have pain thing in there. So there's like a mocktail. So if you can kind of do those at home with herbs and other things, that can help. So sometimes I will caffeine time. I don't know about you, but it can be helpful, but sometimes I feel like it can also be more triggering and stimulating.
yeah, I think it
Yeah.
depends for sure on the trigger. Caffeine, like you said, it for me sometimes it feels like, oh, that didn't wake me up, but now I just feel more sick than I
Yeah.
did before.
Yeah.
So
It's
I
bad.
right. Especially if you're already like nauseous and your stomach's upset, that can
Right.
just make things, you're like, I needed to calm down. This did not help. We didn't mention this, but a lot of studies were not done on females, right? And so I
No.
think like probably the caffeine, probably maybe it's more effective in males. I don't know,
Right.
but it's interesting that like, so I didn't mention this before, but my dad has chronic migraines. So before I started charting my cycle, when I noticed the migraines, I was like, oh no, I got his genes. I was like, great. I would grow up and growing up, he was missing a lot of work and would be in bed a couple of days out of the month. It seemed, I don't know if it was every month, but it was frequent enough that it seemed
Hmm.
to be like three days of the month or something. He would be out. But I remember he would always take it was some sort of Excedrin with extra caffeine
Yeah.
added to it, and he would take those all the time. And for him, that was the only thing that would work.
Yeah.
Which for me, it doesn't help me at all,
Yeah.
which is interesting.
Yeah.
But
It can be
different
hit or
different
miss,
triggers.
right? We mentioned the breath work. So you can, I think, Yoga with Adrienne, she does a good pranayama. She has like a migraine episode on YouTube. That's really good. And that can sometimes help get you through a little bit. I started using, have you ever heard of Evil Bone Water? It
I'm
is,
very intrigued.
I love it. So it's got like camphor and a bunch of like Chinese herbs in it. And it's
Okay.
basically like a topical spray
Okay.
and it's very spicy, but I love it, especially if you have that migraine going into your neck. Or what I'll do is I'll spray it on my hand and rub it on my temples.
Mm.
And it kind of helps to, it has like a cooling yet heating. It's yin and yang or whatever. It's both. So I love in the moment using that with a heat pack for some reason. I know people are like, use ice, but heat always feels better for me. Or like a spicy CBD with peppermint can be really helpful too, for topical pain reduction. So yeah, so I think those are some things that I typically will go to if I'm having one in the moment just to kind of get through. And then lots of rest. I mean, I think it's our body telling us that, okay, maybe we're overdoing it. Maybe we overfill our bucket and we need to just calm down and rest and say no to some things that, maybe we haven't been saying no to.
And even like in my experience too, even if the resting doesn't make the pain go away, it makes the experience better when there's
Mhm.
less pressure on you. You're not pushing through everything, but it's just like, okay, I can actually like nothing right now is an emergency. That can wait till tomorrow and I can rest. It's almost like creating that sense of safety for the nervous system to just really just relax, lay down, and it really helps a lot. So
Yeah.
that is
I
one of
think
the most important
migraines
things.
it's a whole body approach, not just like treating the pain when it happens. So I think
Right.
that's kind of like what we're getting to stop overlooking or to, have someone that can listen and just support you, through this can be also really helpful. Like having a system that works for you and creating that system because yeah, it's hard. It's hard like with kids and, if you're a mother in the household and you're like, I just struggle with these things, that can also, it can be really hard.
Right.
One thing I didn't mention was I did buy, it's called Cephaly. Have you ever heard of it? It's basically it targets the trigeminal nerve. So it's like a TENS unit for your forehead.
Oh.
It's very strange. And sometimes I can't use it because it's so stimulating. Like it's like if you were to use a TENS unit for pain, but you're using it on your forehead and it like, I don't know, it like makes your everything feel very tingly. But they what they do is they're targeting the trigeminal nerve to kind of help relieve that pain. And I have noticed a reduction in pain when I use it, but it is expensive and it was kind of like a last ditch effort for for me. Like I was like, I'm gonna try anything. And so I
Yeah.
ended up purchasing it, but I don't use it as often. I use those other methods before I use that, which is kind of crazy. So yeah.
But I'm glad you found like what works because I feel like migraines are so hard to calm once they're like in full force that I feel like you really have to put in as much of your energy as possible into preventing them.
Hmm.
Um, because I think that's why the sleep is so effective
Yeah.
because it's like that's the only thing that really seems to help at that point because migraines can be quite debilitating once they're actually coming. Like once you actually are in them once they've arrived.
Yeah, absolutely. Is there anything that you would like to add?
Oh goodness. I think we covered a lot. I think one thing that I would just emphasize is if you're somebody who is noticing you're getting migraines that seem to come every month, even if you're not charting your cycle through a fertility awareness method, you can start keeping notes about when they occur to to help you kind of identify what your trigger is, noticing what makes it better, what makes it worse, and the timing of when it's appearing. If you can do it in relation to your period, that would be great. Even best would be cycle charting, but well, if you can't start that right away, at least you can start here just by keeping more notes. And I think that will give you a lot more, that'll help you kind of know where to put your energy when you're looking into what
Mhm.
strategies are going to be helpful for managing it. So yeah, so I think I just encourage you to start trying to like get more curious about what's
Yeah.
happening and when does this happen and what makes it better, what makes it worse, those types of things.
Yeah, following those patterns and really just kind of seeing, okay, is this what is filling my bucket and what do I need to release and get rid of? Because it's, migraines are not a personal failure. They're not a
Yeah.
weakness. They aren't just stress. It's our whole body saying that something is overloaded, inflamed, and needs support. When we start listening to our body instead of silencing it, we can really shift the way we are able to cope and deal with maybe the migraine or they reduce, right? So things make a shift.
And even if
Awesome.
something doesn't take it away entirely, small shifts over time add up. And so I think like
Mhm.
we both touched on it, but usually migraines, you got to be coming at it from all these different angles. So maybe if you just do one thing on its own, it's not going to help. But if you do all of them, then you might see the needle shift pretty
Mhm.
big.
Yeah, absolutely. Well, and getting specific care for you, right? Like, once
Right.
again, just making sure that you are able to like acknowledge, like, okay, this is my trigger, or this is where I'm seeing it, or whatever. That can make a huge difference sometimes, just even just acknowledging that. Well, if this episode sparked something for you, please share it. If you want to learn to chart your cycles with me or Morgan, or start using your body's data as power, I will post Morgan's information in the show notes. Thank you so much for listening. Take care of yourself and have a great day.